Hello, Kidney Warriors! James here from Dadvice TV, your online kidney health coach, and this is Dadvice TV Live. Now, for those of you that are joining us for your first time, and I know there's going to be a lot of them tonight, welcome. It is fantastic to have you here. Make sure you click that subscribe button over on YouTube. That way, every time there's a new helpful video like this one, you get a notification. Now, if you are new, let me quickly introduce myself. My name is James. I'm a kidney warrior, and I like to kick kidney disease to the curb by learning about kidney disease and what I can do to live a healthier and better life and reduce the risk factors as much as I can that I have. Now, tonight, we're going to be talking about something extremely popular, chronic kidney disease stage 3. A lot of you learn about kidney disease when you happen to be stage 3. Now, to talk about things, I've got an amazing co-host here. He is the author of my favorite kidney book. Now, and I know a lot of you that are first diagnosed, you're going on Amazon, you're searching kidney disease, like, oh, I'll buy this book, this book, this book. You get these books, some are real thick, so technical, and they're scary. But his book, so easy to read, and it's going to make you feel fantastic. It is called Learn the Facts About Kidney Disease. And if I could make one thing happen, I would have every doctor that diagnoses a patient with kidney disease hand them a copy of this book and say, hey, I know it sounds scary. Read this book, and then let's talk about it, because this is going to take care of all that scary stuff and let you know what you need to know, what you need to focus on, and things that you should be doing. And if you'd like to get a copy of this book, there's a link there, go.dadvicetv.com/book. It'll take you to this book on Amazon, or what I recommend people doing is go visit your local mom and pop store. Things are tough out there. They would love to have you as a customer, and they could order a copy of this book in for you. That way you can get a hold of it. But my co-host, let's go ahead and bring him up, the author of Learn the Facts About Kidney Disease, Dr. Steven Rosansky. Hey, Doc, how you doing?
I'm good, James. I'm good. How are you doing? I hear you're in some pretty hot weather there.
Oh, my goodness. Hot doesn't describe it.
James, just a quick comment. I'm not seeing any comments from viewers. I guess no one has made any yet. But okay.
No one's made a comment yet that has flown through.
Okay, that's fine. All right. Yeah, so would you like me to introduce myself? I will certainly do that. So my name is Dr. Steven Rosansky. I'm a retired kidney specialist. I've taken care of kidney patients for over 40 years. And in my retirement, I love getting on the show with James. I think that he offers you some very valuable information and the real science, not things that are just woo-woo, as I call it, things that really come from lots of research by folks like me that have done work on kidney disease, so that we can help tell you the facts about what to expect. And I picked this topic, stage 3, tonight, because I get, and James gets, so many folks that are given the diagnosis of kidney disease because they have so-called stage 3. And I titled my talk here, Why You Shouldn't Worry, because most of you who have stage 3 should not worry. And I'm going to tell you why in a little bit.
Awesome. Yeah, stage 3, I wish I had learned at stage 3, but for me, I learned at stage 5. But so many people, as a matter of fact, I had a couple that emailed me today, just recently diagnosed within the last day or so, stage 3, and they had a lot of questions. And as you and I both know, we talk about quite often, there is so much misinformation out there on the internet. So tell us what we need to know.
Well, first of all, why stages? Why do we even have these stages? They came out in around the year, about 20 years ago, and with good intentions, you know. And as one of my research and good friends, colleagues told me about the stages and about people starting dialysis unnecessarily early, he said, you know, our colleagues have good intentions, but don't forget the road to hell is paved with good intentions.
Mm-hmm.
So the stages are all good intentions. And one of the main things that my colleagues were trying to do is to diagnose kidney disease early, which makes sense, to try to slow its progression, keep people from having to go on dialysis, and also to try to prevent kidney disease. So, but what most of you and a lot of my colleagues don't know is that, especially if you're stage 3, and by the way, let's just define it. Stage 3 is that famous EGFR, your kidney number, um, of 30 to 60. And there's nothing magical about this. We got a bunch of folks like me get together and say, hey, let's produce some stages and let's use this kidney number and let's figure out what makes sense. So they came up with these 5 stages, and we're going to dig into them in a minute. But what a lot of folks don't know, and James knows this well by now, that for most people, this is just like having high cholesterol or high blood pressure. Having an EGFR of 50 or 40 for most people, or even 35 to 40, is a risk factor for getting what, James, your favorite word?
I knew you were going to try to make me say it. Arthrosclerosis. Did I get it right? Hardening of the arteries. I like that version of it.
Yes. And we laugh about it, but this is the commonest way most of us are going to die from heart attacks, heart failure, and strokes, cardiovascular disease. And a decrease of your kidney number raises the risk of that. But even more important than your kidney number is what, James? And you know this too.
Oh, sorry, I was not listening to you. I'm sitting here going through all the comments.
Even more important than your EGFR is what other lab test?
Protein leakage.
Urine.
In your urine, yes.
Urine protein. So both a lower kidney number and a higher urine protein are not good. They are things that will predict further decline of kidney function, especially the higher urine protein number, which we're going to get into.
And you talk about that in your book, which is one of the things that actually I liked so much, was learning about that. When you go to websites and you learn of the stages, I have yet to see one that talked about the protein leakage in your urine as an additional indicator of
it's so important.
how serious things are.
And we're going to get into it in just a minute. It's probably more important than your number, as you'll hear in just a minute. So let's knock off another big misunderstanding. Okay, I got stage 3. What should I feel? Should I have pain in my back? Should I be nauseous? Should I be vomiting? And there's a lot of misinformation, and there's a lot of people that are going to try to sell you stuff because it's become a massive business, this stages of kidney disease. Anyway, the bottom line is rare to have any symptoms. No aches, no pains, no symptoms from your kidney disease. Rare for stage 3. Maybe starting in stage 4, which is below 30. But all the stuff of, I'm going to put you on the magic pill to get rid of your symptoms. You don't have symptoms from stage 3. Your kidneys are not going to hurt. So just makes no sense. Makes no sense. Okay, let's do away with the other thing that as soon as someone gets a diagnosis of kidney disease, and most of you, the vast majority of people with so-called CKD or chronic kidney disease have stage 3. So what's the first thing you worry about, James?
Oh, sorry, I'm sitting here going through the comments, typing responses. So when if I hear that or most people, when they're diagnosed stage 3, they're worried about what can I eat, because they think they can't eat anything.
What do you worry about? What do you worry about the most immediately?
You got dialysis. I don't want to go on dialysis.
Absolutely.
That is like number one of everything. No dialysis.
People hear kidney disease. They got a stage. It's 3. It's not 1 or 2. I'm probably heading for dialysis. I could tell you not to worry. If you are stage 3 and you do not have significant protein in the urine, which we're going to talk about what that means, it is extremely unlikely that you're going to wind up on dialysis. So let's get that clear. That's an extremely important thing because everybody worries about that. So the other thing that James and I was just talking about is that there's so much information that has come out since 2002, when these stages first came out, 20 years ago now, that we know a lot more about that EGFR and the stages. And during the past 20 years, there's been an enormous amount of confusion amongst us docs and lab folks because we've had many different ways to determine that EGFR. We've had many different lab methodologies to determine the creatinine, which we'll talk about. It is the most important determinant of the kidney number, but it doesn't really do anything to you. It's just a marker in your blood that's used to determine your kidney number. But there's been a lot of changes in that in the last 20 years. So one of the most important things that took, I don't know, at least 10 years for my colleagues, and I'm part of the academic world. I've done a lot of research myself. I've given lectures to a lot of kidney docs. I talk to a lot of the people that are, the professors in the kidney world. And what we've basically come out with, and not everybody is doing it yet, is that if you get a kidney number above 60, don't report it because it's unreliable.
Yep.
So all those numbers between 60 and 100, they're just not reliable enough to even report. And that's the 60 to 100, which is the so-called stage 1 and 2. And so the question is, let's do away with the 1 and 2 stage, right? So we're going to focus on 3 for tonight. Let's say that you have an over 60. Can you still have kidney disease, James? That's a trick question.
Well, what other symptoms do I have?
No symptoms. Remember, we talked about symptoms not happening until you get way lower down.
All right, am I leaking protein?
Yes, James. Now you hit it.
That's what I meant. That's what I meant by other symptoms. What other factors are there? That's what I should say. What other factors? Am I leaking protein? If I'm not, woohoo! If I am, okay, let's talk.
So here's the deal. And UK, and I'm going to talk about Australia a little later on. UK is way ahead of us in the States. And part of it is because you have national health insurance. And we have the business of medicine up the wazoo in this country, which is very sad. And we don't get anywhere near what we pay for. We pay double of what they pay for most other places around the world in the developed world, and we don't get our money's worth for sure. But the UK, they said something smart. They said, I will say you have kidney disease. These are their guidelines. If you've got significant protein with a number over 60. What's significant protein? Let's break it down. On your dipstick protein, 2+ or more, right? You've heard of the dipstick protein. Or, and I'm not going to get into the units, or a 300 in the US, which would be a 30 outside the US because they use different units. So if you're over 300 in the US or over 30 outside the US, and you're over 60 on your EGFR, that's kidney disease. Otherwise, over 60, probably not worth discussing. And as we talk a little bit more, you're going to see just how off the mark those numbers really are. What about the levels of protein in the urine? So low levels of protein, just like high levels of EGFR, they're not reliable numbers. So you may have, so low levels are between 30 to 300. As you get close to the 200, that starts to get more serious. I would say over 200 for the US, over 20 for the European countries would be significant protein, okay? And that's pretty rare. It's probably less than 2 out of 100 people are going to have that much significant protein. And there are things with lower levels of protein. Let's say you've got let's say instead of, I'm talking the US, I hate to confuse Let's
Yeah,
just say
yeah, the confusion of the conversion.
in the U.S., 300, let's say, is definitely serious protein. And let's say you have a 30 or a 40 or a 50 or a 60 in the urine protein. That could vary a lot day to day, just like when you have an EGFR of 70, 80, or 90, that can vary a lot day to day. So those numbers are not real reliable. But if you've got a significant protein consistently, you've got kidney disease and you've got a little bit more concern than someone that just got EGFR in the 30 to 60 range with no protein. Really important. Next question, another trick question for you, James. What's the easiest way to cure kidney disease?
A transplant?
No, that's a trick question. Trick question.
There is no cure.
That's true. That's true. But there is. But some people will come
Oh,
in and say, "Doc, I got an abnormal number, and what do?
you're
I
so
re,
you got
I
to
re,
repeat the test. They may
I
just be
repeat the lab
dehydrated.
test. I repeat the lab test. I can't
Yeah.
tell you how many times, dozens of times, that people come in with an EGFR of 40 to 60, and I say, well, look, to define, this is something that the academic folks like me, we got together and said, because of this variability in that number, and the numbers can vary easily by 20 or 30%. So a number like 60 can be up or down by 12 or 18 points, up or down from 60. So you need to have a number below 60 more than once over a period of at least 3 months. So don't even get worried about one EGFR of 45 or 50. It needs to be repeated. And a lot of you are going to be cured by, by the second lab test. Okay. And so
Hey
that's
doc,
the,
I wanna
yeah.
bring up one question. This is a really good one that I know a lot of people with kidney disease are confused by. Someone asked, darn it, where was it? The question was pretty much, what should I look at on my labs? Is it the creatinine level or is it the EGFR?
If you,
That's a trick
that
question for you too.
it's not, it's, look, okay, let me give you an example. Okay. If you have stage 3, the creatinine is what they plug into the formula to give you the number, the EGFR. And you may have stage 3, say a 50 or 40 or something like that, with a creatinine of 1.3, right? If the creatinine goes down to 1.2, it's a massive change in your EGFR. So when you're close to a normal creatinine, those EGFRs are going to vary wildly as that creatinine goes up or down by 10 or 20%. Okay. So you got to be a little sophisticated to use creatinine. I like to use creatinine, but stay with the EGFR and don't ever get hung up on what, James? One number. Don't ever get hung
Exactly.
up on one number. Your one number, if it was 60 and now it's 40, it could be 70 next time you go to the doctor. Look at the trend over months or years. That's all that matters, not anything happening over short terms, over short time intervals. So, when is stage 3 not kidney disease? When can you have a 30 to 60, all right, and not actually consider it kidney disease? And James knows this, but I won't
Well, I'm going to
necessarily.
say you can have an injury, an AKI, acute kidney injury.
Right, right. But
Something
that's
happened.
still kidney disease. But what I'm getting at is something we've talked about over and over again relating to age.
Oh, yeah, the natural decline in it.
Right. And there are some labs. Okay, so we've known for a long time that kidney function declines with age, just like every other function of your body, your brain, your heart function, everything declines with age. And kidney function declines with age is to be expected. So there are some labs that are not only saying over 60, we're not even going to report on the EGFR, but they're also saying we need to age adjust your EGFR to tell you whether you've got kidney disease. One way to age adjust it is to take your age, let's say you're 80, divide it in half, and add it to your number. So if you got a 40 and you're 80, you could come out with an 80 number. Not so bad, okay? But I like what they've done in Australia. In Australia, they have said that if you are over 70, and they're way ahead of us in the US, and your EGFR is over 45, and you do not have protein in the urine, you don't have kidney disease according to the Australian guidelines. I wish that we would come up with the same kind of guidelines in the US, but I think that makes a lot of sense. So those folks that are 70 to 100, a lot of you are going to have an abnormal number. Not to worry. Not to worry.
Just natural age.
Yeah. And the question is, at what number are you going to have to worry about the nasty dialysis, right? And at what number is your risk of hardening of the arteries going up? And what they found is for older folks, let's say over 70, 80, 90, it's probably less than 45. But more importantly, if you are 78 or 90, please don't let your doctor put you on a kidney machine with an EGFR that could go easily to 15. And so many older folks that's happened to. No need. And we're going to get to that in a few minutes. But if you're over 70 and you don't have significant protein in the urine, you do not have kidney disease if your EGFR is over 45, roughly, okay? Now, what about if you've got stage 3? Are you off the hook? Can you never go on dialysis? And James knows the answer to this.
Nope, that doesn't guarantee it, but it doesn't guarantee you're going to go on it, and it doesn't guarantee you're not going to go on it. Well,
I would say, as we just said earlier, James, that if you're stage 3, and let's leave age aside for now. Let's say you're stage 3, 30, 60, in that range, and you don't have a lot of protein. If you're a younger person, it's possible. And what happens is, as you get older, you've got things that are going to probably do you in, like a heart attack or a stroke or something else, way before your kidney failure will do you in.
Can you define younger folk, just so everyone knows?
Well, look, I think basically...
I think I'm younger folk up here, but let me tell you something. The AARP things I get in the mail don't say that.
Let's put it this way. As you go from 20-year-old to 30 to 40 to 50, the younger you are, the more likely that you're going to have more time to be alive and get more damage to your kidney. It just makes sense, right? But the important thing is, how fast is your kidney function declining? And for the most part, older folks lose kidney function much slower than younger folks that have kidney disease, because older folks usually don't have a lot of protein in the urine. The primary determinant of how fast your kidney function declines is how much protein's in the urine. And if you're older, you're losing maybe 1 or 2 units of kidney function a year, maybe. But if you're a younger person with a good bit of protein in the urine, you got a 300 or more in the States, or over 30 abroad, you can be losing it at 5 units or more per year. And remember, and we talk about this numerous times, there are certain drugs that if you have protein in the urine and you've got significant protein in the urine, be sure your doc has you on the important drugs, the ACEs and the ARBs, the prils and the TANs. We've talked about this many, many, many times. The problem is that so many docs stop the drugs because your kidney function gets a little worse when they start these drugs. But that's expected. And again, if you've got significant protein in the urine and your doc has you on an ACE or an ARB, a pril, a captopril, an enalapril, a TAN, losartan, etc., say, hey, doc, I heard, and you could bring my book up and you could show them my information from my book, that some docs, some experts are saying, even if my kidney function drops by as much as 30%, we should keep these drugs going and just follow me up to make sure that it stabilizes, because they can slow the decline over years. And then we also have the SGLT2 drugs for diabetics, and we have other drugs in the pipeline that are showing a lot of promise, especially for people with a good bit of protein in the urine, to keep you off dialysis. And that's going to be for another talk. So you can, as James said, and I think James experienced this, you can get to a point where someone's going to want to put you on dialysis when you're a stage 3 person. Because what happens to you? You get what James just said, AKI. It's called acute kidney injury. It means instead of just losing 1 or 2 units a year, you all of a sudden have a big drop in your kidney function. And it could be due to many things. And James just is drinking to your health, and he's doing that because that may be one of the commonest situations where someone with a EGFR of 30 to 60, a stage 3, will go to a stage 4 less than 30, or even a stage 5, less than 15. And this can happen, especially in this heat. Please, if you're in this heat, stay hydrated. If you're an older person, and I'll use my age, 70, 75, as older folk, you won't know as much as the young folk if you're getting dehydrated. Push the fluids. Don't allow yourself to get dehydrated. Quickest way to go from stage 3 to stage 5 is getting severely dehydrated. And the medicines, as we talked about, the ACEs or ARBs, are expected to cause some decline. That could do it too. And then the other thing is, some people are getting overtreated for their blood pressure. And as we've discussed on this show, if you're on blood pressure medicine and you're feeling weak or dizzy, please don't take your blood pressure pill until you check your blood pressure, especially in the standing position where it may drop when you stand up. And if your blood pressure is running below 110 or below 100, hold the dose. It's not going to hurt. Better safe than sorry, because too low a blood pressure can take you from stage 3 to stage 5 real quickly. And so many of us are on, let's say we're on an ACE or an ARB, right? The Prills or the TANs, or we're taking an NSAID. We're taking Motrin. We got various aches or pains, and we take an NSAID like Motrin. Taking those drugs with dehydration is a common situation where people who are stage 3 doing fine wind up in the hospital, and sometimes they get put on dialysis. And unfortunately, a lot of docs don't look back to see if kidney function has recovered. And I tell you a story in my book about a famous Art Buchwald that happened to him, a famous columnist. And besides the ACEs and the ARBs and the NSAIDs, a lot of you people are taking stuff for stomach trouble called the PPIs, the Prilosec, the Prevacid, the Nexium. That and a lot of other commonly used drugs can also take someone in stage 3 and make your kidneys sick, give you acute kidney failure. One of the commonest ways that people wind up from going from stage 3 to being put on dialysis is heart failure, especially older folks. And the commonest scenarios, they're going from stage 3 to stage 4 or 5, are going to be people that are getting dehydrated, people who get worsening of their heart function. But remember this: if your kidney function changed a lot, try to get your doc to tell you, hey, can this be reversed? I don't want to go on lifelong dialysis. Mm-hmm. And if I have to go on dialysis, doctor, will you check to see if my kidneys recover? Important questions which are not asked, and sometimes patients never discover that their kidneys got better. Now, what should you do and what should you not do if you're told you have CKD3? Let's go down the list. And we're going to save time for questions. I
We
promise.
got lots of questions tonight, Doc. And I'm
Because
hoping on your list of things not to do is to go on the internet and find all the woo-woo and buy it. I hope that's on your list of things not to do.
yes, well, we're going to break them all down, and you're going to love this, James. Anyway, I hope I can answer questions to help some of your worries. Now, forget about what you're hearing on the internet. Here's a way to lower your creatinine. It is nonsense. You don't lower your goal is not to lower your creatinine, because the creatinine is just a marker. It's in your blood. It's a normal thing in your blood that comes from muscle breakdown. It's totally normal. When people say, other than my joke about what's the quickest way to cure CKD, that's a joke, repeat the lab. But you're going to see this online. I'm going to cure your CKD. Nonsense.
Wait, but doesn't it come in a bottle?
Yeah, we're going to get to the bottles in a minute. And then you get on these websites and they say, your kidney function is going to get progressively worse. Well, you know what? Not true. There are so many people, especially older folks, whose kidney function can remain stable for 10 plus years. So it is not going to invariably get worse. And the vast majority of you, that's not going to happen. They also tell you, oh, 1 out of 3 of you have kidney disease, and I'm going to tell you how to cure it. Not true. Maybe 7 out of 100 have real kidney disease, if you look at the recent well-done research. What about that naturopathic crapola? Don't fall for it. Don't get involved with people pushing herbs. No probiotics have been proven to help your kidneys. Don't get on the herbs. Don't get on the probiotics. Another red flag. If someone gives you testimonials, forget it. Get off their website. Get out of their book. You don't want to read testimonials. You want the research. There are folks like me and my colleagues and the drug companies that spend tens and hundreds of millions and billions of dollars on research to figure out what really works. Use the research to see what really works, not testimonials. Hey, I did this and I got this. Okay. And again, don't try to be on a diet to lower your creatinine, because that makes no sense. It's not going to help your kidneys. Don't stay away from people like kidney coaches and people that are going to get on shows with a white coat. Just like testimonials, people
And a
get out
stethoscope, maybe?
a white coat and they're not really credentialed. They have no medical education and experience, and they're going to tell you what to do. Shut them down. Kidney repair pill. Oh, no such thing. Nonsense. Natural diuretics, you don't need them. If you really need a water pill, there's lots of them and they work great, but have your doctor give it to you so you can take it safely. What about drinking lots of water? Now, I am not opposed to drinking water, especially if you're an older person, especially in the heat. Or if you got kidney stones, the best way to prevent another stone is drink a lot of water. Yes, indeed. But you don't need to otherwise. You can use your thirst mechanisms to figure out whether you need to drink water. No need for any special vitamins, and no need to obsess over diet. I know so many of you have body image issues. There is weight shaming, which is just horrible. It causes stress. It causes emotional trouble, raises your blood pressure. Remember, most diets, 90% of folks on crazy diets, and if you go back to some of my Dadvice shows about diets, they gain the weight back. you need to make lifestyle changes. And we're going to get into them in just a minute. Part of the lifestyle changes on your diet, I'm all for plant-based diets, even for stage 4. Plant-based diets are good for all of us. Plant-based diets are going to be relatively low in protein. No need to restrict protein. No need to buy protein supplements for people that are on very low protein diets. That's nonsense. There is someone who's got a competing book that's what it's all about, because this particular book and person is also selling these supplements to take with very low protein. If you're diabetic, it's extremely dangerous. You can die from hypoglycemia to getting on these extremely low protein diets. If you are on a plant-based diet, it will be relatively low in protein, and that's all you need to do. Low sodium, yes, that's good for your kidneys. It's good for your blood pressure, and it may actually slow the decline of your kidney function. Exercise, you're not exercising to lose weight. You're exercising for your heart. You're exercising for maybe your kidney function and for your brain function. You're not going to lose weight by exercising, because we basically burn what we eat. Stop smoking. Most important way to add life years. And there's an interesting program proposed in the UK where they're trying to make the UK smoke free. I give the UK credit, boy, by 2030. Smoke free. That's a great goal.
Yeah, I love that.
And yeah. And we've talked about getting your blood pressure to goal, real important. And the latest advice on blood pressure goal is probably around 110 to 120. Some older folks may not be able to tolerate it, but if you can, that's what you should be shooting for. And if you're diabetic, most of you who are above 70, if you're not, let's say, below 50 in age or 40 in age, no need to go crazy with tight A1C control. Will not really help slow the decline of kidney function. If you're an older person with kidney disease, a 7 to 8 A1C should be fine. Now, the last thing I want to touch on before we get to questions.
I have one
James.
question.
Yeah.
What about all of those, and I get these every day, probably a dozen emails asking about this. What about those kidney flushes to unclog my kidneys so they work better?
That's my answer.
Yeah, there you go. Perfect.
Absolutely ludicrous and nauseating at the same time. It's totally senseless. Absolutely, and may be dangerous. May well be dangerous. And stay away from herbs. Stay away from supplements, because they're not FDA tested. You don't know what's in them, and they can have potassium in them. They can have dangerous things in them that could hurt you. Stay away. Part of the whole deal with stage 3 is and I just got on the website tonight looking at one of the famous American healthcare systems, Kaiser Permanente, and their website.
Doc, I can bring that up. Oh wait, it's not.
If you can, it's cool. Yeah, but yeah, if you can.
I got it. Let me see.
Okay. Well, James.
Up.
One.
That was a karaoke song. My daughter recorded a karaoke video on my computer, and that was it. Anyway, okay, Kaiser Permanente, and I'm glad you're talking about this, because I was dumbfounded by this, especially being I lived in California. You heard of Kaiser Permanente everywhere.
Well, I'm not blaming Kaiser, but so many of my colleagues and so many organizations are publicizing stuff about the stages of CKD. And one of the things that they say on the stages is if you are stage 5, which is 15 or less, get ready to go on dialysis or transplant. Nonsense. And that's one of the reasons why someone who's stage 3, which is, let's say you're 30 to 40, and you hear, well, stage 5 is 15, I'm going to go on dialysis, I'm close. Nonsense. And my research, please read my book. Anyone who is anywhere near dialysis, I talk about the appropriate level of kidney function when dialysis should be considered. And it certainly is not 15, and it certainly is not over 15, which people have been put on dialysis thousands and thousands, which is a shame to me, and certainly not even 10 to 15, maybe 5 to 10. And my research and research by my colleagues says less than 5 may be where you really want to be shooting for, but not everybody can wait that long. And read my book and go over it with your doctor, but no rush to get on that machine is in it. Your kidneys, even with 5 units of EGFR or less, can do better than any kidney machine has ever been able to do. Save your kidney function, because you go on the machine, your kidney function is going to disappear quickly. Do not rush to get on. And that's one of the reasons why there's so much fear about stage 3. Again, think about it. Hey, I'm 30. These people are going on 15 and even higher. It's nonsense. It's crazy. You got to consider your age. You got to consider how fast your kidney function is declining. And what they say, I'm reading my note about what was on that Kaiser website. It says stage 1 to 2, it says stage 3A, you got a moderate decline of kidney function. Well, you may have normal kidney function. 3A is 45 to 60. Hello, if you are over 70, we may consider you normal, but no, they say it's moderate decline. And they say 15, start dialysis.
Stage 4 was pick what you want, dialysis or transplant. That's what it said for stage 4.
Okay, but they do say one thing, which I agree with, which we don't have time to talk about tonight, which is called palliative care. Now, here's the deal. I can't tell you how many folks that I've seen in the VA, they were older folks in their 80s and 90s, and they said, I don't want dialysis. Mm-hmm. They lasted with 5 units or less for years. And we treat their anemia so they're not short of breath. We treat their potassium. You could do fine in many cases. And so palliative care means non-dialysis care. But that's for another evening. But I will try to answer some of the questions you got, James.
Oh boy, do we have a lot, Doc. We got a lot of people on here live. And let's see, I marked a few of them. Someone asked, what stage should you start watching your vitamin intake?
Your vitamin intake is meaningless, as I said. If you have a really unusual diet, you're not getting enough fruits and vegetables, and you're eating minimally, a multivitamin is fine. If you have stage 5, you may want to have a special vitamin for kidney patients if you're not eating well. If you're on dialysis, you got to have a special vitamin, because some of those vitamins can be removed by the dialysis itself.
Very good. And John asked, so he's 40 with a 1+ protein. Should he be worried?
You should not be worried, but it needs to be followed. And look, if you've got protein in the urine at all, and you're likely to have high blood pressure, you should be on one of those drugs we talked about, the ACE or the ARB. It will help decrease the protein in the urine, and it may slow the decline of your kidney function, especially if you're 40. You got a long life ahead of you. So, and my book lists all of the various ACEs or ARBs, and you should be on them. And again, even if you have some decline of your kidney function, discuss with your doctor whether you should be continuing them or not. Because far too many people stop them with protein in the urine. My thinking is not everybody with CKD needs to be on an ACE or an ARB, but if you consistently have protein in the urine, 1+ or more, certainly 2+ or more for sure, be sure to get your on ACE or ARB. If you're diabetic, get some of those new SGLT2 drugs, the GLP-1 drugs, which we'll talk about on another show.
Here's a question that after I was diagnosed, I had this exact question. Teresa asked, where do you look on your blood work to find your protein?
Okay, so there's blood protein, which is called albumin. And that's an important marker for your health. It tells you a little bit about your state of nutrition. That's a long discussion. you're not looking at the protein in your blood, it's your urine protein. The way to monitor urine protein is if you go to the doctor's office, they could do a little bit of urine and put a dipstick in it to get a urine protein test. It's a dipstick protein. The other, much more reliable and accurate way is you send a specimen of urine to the lab, and the lab will get the urine protein to creatinine ratio, or the urine albumin to creatinine ratio in the urine. And that's a good way to get a handle on how much protein is coming out in the urine. Serial EGFRs, serial urine, spot urines, protein to creatinine ratios or albumin to creatinine ratios is the best way to see how you're doing regarding your kidney disease and whether or not the ACEs or the ARBs are lowering that protein in the urine, which is a good sign, which may mean that you're slowing down the decline.
All right, here's a couple good questions. Tammy asked, she was born with only one kidney. Is all of this the same as somebody who has two kidneys?
Absolutely. Absolutely. The only thing, well, first of all, I don't know if it's a horseshoe kidney, which is a whole different discussion, but you only need one kidney, which is the reason why anyone who is willing to can donate a kidney to someone who's got end-stage kidney disease. You only need one kidney. So everything that we talked about applies to someone with one kidney. There's certain things about one kidney that you're not going to biopsy because you can, God forbid, lose the kidney, and and any of the things that people with two kidneys need to do, someone with one kidney would need to do the same things.
Awesome. All right, we're making through so many of these questions. This is awesome. When do you need a 24-hour urine test?
You don't ever really need one. I will tell you this. If there is confusion about your EGFR, and that we used to do 24-hour urines to get a actual measured kidney function called creatinine clearance. We don't do them anymore because no one wants to have jugs of urine in their fridge. No one wants to be bothered with the collection. And getting serial EGFRs that are cheap to do is good enough for most people. But if there's a question, and there's certain situations where you have lots of muscle or very little muscle, which is the primary determinant of creatinine, and that EGFR may not be reliable, there's something called cystatin. Cystatin is a very reliable methodology to get your kidney function, cystatin. So if there's debate about it, ask your doc about getting a cystatin kidney function measure. 24-hour urine for creatinine clearance is fine. I mean, it's an actual measure as opposed to an estimate. EGFR stands for estimated kidney function. If you do 24-hour urine and you do it right, you'll get the actual kidney function. I used to do them routinely for protein to figure out how much protein is in 24 hours, but you can get a pretty good handle on how much protein you're spilling or what the trend of your kidney number is by getting serial EGFRs and serial urine proteins.
Yeah, I remember doing one of those 24-hour ones. This was pre-COVID, and I did it while I was at work, and I would never want to do that again. Though I was lucky. None of my coworkers took my jug, but if they did, they would deserve it. All right. Here's a question. I lift heavy weights. Is that bad for kidneys?
Lifting heavy weights?
Yeah.
Yeah, well, okay. No, but there is a possibility that you can cause a short-term problem with your kidneys if you exercise extreme exercise and your muscle breaks down, whether that's a triathlon or marathon or extreme heavy weightlifting. If you do it to the point where muscles break down, the products of muscle breakdown can hurt your kidneys and cause them to shut down. So it is possible, but unlikely, especially if you're doing it reasonably, you're not overstressing your muscles. Okay.
David says he found out last week, he was told he's stage 3. How long should he wait before his follow-up, his next set of labs?
Yeah, I think to be sure that it's an accurate one. 3 months later, repeated. And if you get to see your doc, at 3 to 6 months, it makes sense. And again, it depends on how your kidney function story is playing out. If you've got a lot of protein in the urine and your kidney function, because of that association of high protein and more rapid loss, I would see you more frequently. But for the average person, once or twice a year is probably fine. And 3 months to be sure you really have it, according to the diagnostic criteria.
Here's an easy one for you, Doc. Frankenstein says, I'm 40 years old and my EGFR just came back at 64 with no protein in the urine. Is that stage 3?
I'm sorry, how old?
40 years old.
Yeah, and the EGFR. Okay, so you need to repeat it. Okay, again, look at the trend, follow your urine protein, and you're 40 years old and you're around 60 is probably, if it stays around 60, it's probably not normal for a 40-year-old. And I would certainly take seriously all the lifestyle issues that we just enumerated about gold blood pressure, stop smoking. We didn't mention this tonight. Try to get your LDL, your bad cholesterol, below 100, and ideally even below 60 if you're diabetic. No, and a plant-based protein diet. Yeah, and exercise for sure.
Kathleen asks, and this is an awesome question. She says, how do I find a nephrologist that's as knowledgeable as you, Dr. Rosansky?
Listen, I would say that you've got a trade-off. I'm an old guy, and my training is a long time ago. I just went to I didn't tell you this, James, my 50th reunion. I graduated medical school in 1972. I just came back from Buffalo, went to UB. And look, people that are more recently trained don't have the experience I have, but they have, more recent knowledge. But I pride myself on staying up with stuff. Mm-hmm. If you are going to see an older practicing nephrologist, they may not stay up with stuff as much as a younger nephrologist. That's the only thing I would say out there.
Now, in your recommendation or your opinion, how much caffeine can a person have in a day? He says he's 3B.
Nothing to do with caffeine. Nothing to do with caffeine. I mean, I think caffeine is okay. It may actually have a health benefit. I think extreme caffeine is not good because it's going to raise your blood pressure, and that could be a health harm. But nothing for kidneys.
Now, Ron says he's 76 years old and his protein creatinine ratio was 0.33. Does he need to worry?
Yeah. So So again, look at the trend and follow it up and be sure. And I don't know if you're diabetic. If you're diabetic, try to get on one of these diabetic drugs, the SGLT2s, the GLP-1s, that lower urine protein and slow decline of kidney function. At a minimum, get on an ACE or an ARB that we talk about on these shows and in my book. So yeah, if you got 0.3, which I guess would be 300 milligrams per deciliter, which is significant protein, that's something to keep an eye on and something to be following at least a couple times a year and trying to take the drugs that can help decrease the protein in the urine, and certainly get on a plant-based diet, which is relatively low in protein. Okay.
Here's a diet-related one, but I definitely want you to chime in on this. Is eating rice bad for your kidneys?
No, absolutely not. I've never heard anything like that. That doesn't make any sense.
Yeah. Well, here's the challenge. A lot of these websites or a lot of the Facebook groups say, "Oh, this is bad for your kidneys. This is bad." If the rice travels all the way to your bloodstream and to your kidneys.
There's nothing bad other than things you may get on the internet, like herbal treatments, like probiotics or other things that are not regulated by the FDA. All foods are fine. Fruits and vegetables are the best until you get down to stage 4 or 5, when you got to at least monitor your potassium, because fruits and vegetables can have a lot of potassium. But that's the best, plant-based.
Can a person start getting breathing problems in stage 3?
There are people, as we talked about, that have heart trouble, and especially if you're an older person, older folks that have a weak heart are going to have a weak kidney secondary to a weak heart, and they will commonly have, an eGFR of 30 to 60. And as the heart gets weaker, as their heart failure gets worse, their kidney function can go down. Very common situation for older folks getting put on dialysis. My advice to someone who is in that situation: ask your doctor, can this be managed medically? And there's a lot of medical treatments for heart failure before you go on the machine to manage your fluids and your shortness of breath.
Now, we only have a few minutes left, Doc. Are there anything on your side that you'd like to answer? It's been a busy night. It's a great night for chat. So excited. And while you're looking, I'm just going to remind everyone that I only have one more show this month. Then I'm taking some time off because I'm relocating, moving up to Michigan. So I won't have any live shows next month or the last week of this month. But I will be back in August with Dr. Rosansky, our first co-host, right at the 3rd of August.
Anna asks, labs are good, but albumin creatinine 81. I mean, 81 is pretty low. And eGFR is 31. I mean, that needs to be followed. And 81 is not zero, but it's not as serious as and again, I don't know where you're located, as over 300. Someone wants to improve muscle loss. Exercise. Urinating at night, frequent urination is common, L-Rich. Every 2 hours, that's called frequency. And that's not your kidneys. That's your bladder. That's probably your prostate. It's probably not your kidneys. So that's something that you may want to ask your doctor to send you to a urologist. I call them the plumbers. They deal with things about too frequent urination or not able to pass urine. I don't know about 9%. There's 9% protein. It's not the way they record it. They record it in ratios of albumin to creatinine, or protein to creatinine. I don't talk about multiple kidneys, and I think if you got multiple kidneys, you can donate a kidney. Losartan is a good drug, especially for somebody who's got protein in the urine. It's an ARB. eGFR went 60 to 70. Okay, so here's Elisa. This is a classic. Don't obsess over your number. 60 to 61 to 70 may be the same number. And and that's what I was trying to tell you. The creatinine went from 1.12. This is a great example. This is perfect. Remember I told you, when you're at creatinines that are close to 1, little changes could cause a lot on your eGFR. It's a perfect example. Her creatinine went from 1.12 to 1.04. The lower, the better, okay, on the creatinine. The eGFR went from 61 to 70. It jumped 10 points with this tiny change in creatinine. That's why over 60, the best labs are saying, we're not even going to give you the number. How am I doing? I got any more time?
We'll say one more question.
Okay. Stage 4, trying to get back to category 4. One doc tells me it's okay to drink it. I have stage 4 kidney. I'm trying best to get it back. Category 4. One doctor tells me it's okay to drink tea. I
don't know what the question was there.
Oh, okay. All right.
A lot of people ask about foamy urine, and we just got one in. And a lot of people think that when there is foam, that it's instantly protein leakage, and that it indicates their kidneys.
No, there's no dipsticks are cheap as anything. So you go get somebody who's got lab available, and you do a dipstick, and you'll know right away. Someone is 40. Okay, do we do that already? 64 and 40-year-old. We did that. Okay.
Yep, we already did that. But we are at the top of the hour, Doc. Yeah, that's good. We got quite a few, but Doc will be back August 3rd, so make sure and set your calendar. All right, everybody. This has been a wonderful night. Thank you so much, Dr. Rosansky. I want to remind everyone, as you guys saw, he's so easy to understand. He makes it so easy and so comfortable to talk about kidney disease. If you haven't already, get a copy of his book, Learn the Facts About Kidney Disease. You can go to the URL go.dadvicetv.com/book. That will take you straight to it. There's also a link down below in the description. You can click on, that'll go right to Amazon, but your local mom and pop store can also order that book in for you. It's an outstanding book, and I wish everyone had a copy of it. I will be back next week for my final show before a little summer break as I pack up everything, move to a new house up in Michigan, get all set back up and started. I can't wait to get to my new place. All right. Thank you so much, Doc. And thank you so much, everyone out there. And I will see you all in the next video. Bye, everyone.